My name is James Roberson. I work for the South Alabama Regional Planning Commission, area agency on aging. Basically, in a nutshell, we provide services for seniors and people with disabilities throughout the Mobile, Baldwin, and Escambia County region, okay? So that's pretty much our deal. We get state, federal dollars to provide assistance. So I have a couple of programs that I actually coordinate for the area agency on aging. And today I'm going to talk about one of them. And this one is called the SMP program, also known as Senior Medicare Patrol, okay? So I provide Medicare assistance for people throughout the region, and as it relates to seniors and people with disabilities who need assistance with that. We get a federal grant known as SHIP, stands for the State Health Insurance Program. So as people kind of engage with Medicare, whether you're starting out, been on it a while, kind of see a commercial on television, kind of want to know how it works, what it is, my job is to give you free, unbiased assistance with that, right? I'm not an agent, not a sales rep. We don't provide any of those type of services from an agent-broker relationship. We are here to provide assistance to you at a local level, though, but we have zero skin in the game. Matter of fact, it is illegal for us to be a part of any brokerage firm or work for any private sector company. Your tax dollars fund this program. And because of that, my job is to make sure that you have a safe place to go with any grievances or issues that you may have. Basically, we empower seniors to prevent healthcare fraud, right? Particularly with Medicare. We do this by assisting Medicare beneficiaries, their families, and caregivers to prevent, detect, and report Medicare fraud, errors, and or abuse. That's basically our stance. Now, we do recruit volunteers to help us go out throughout the community and educate people to just basically remind you all that Medicare fraud is actually a thing. It does happen way more than most people would ever even believe. I mean, it is a significant issue. This is not something that goes, well, unfortunately, it does go oftentimes unnoticed, but people in our profession realize it is a nightmare for most folks once you realize it has happened. You know, just to kind of let you see the impact of Medicare fraud, it's roughly a $60 billion problem annually, right? $60 billion come out. It's this way simply because most people, when fraud has hit them in some way or abuse, they have no way, they really don't know that it's happened to them, right? Usually the way they find out is off of when they're in need of something. So the Medicare summary notice, we always want to look at our statement. Some common fraud schemes. Genetic testing was a big issue. Medical identity theft, we know that happens. Medicare card scams, that's another one. You know, people will tell you, hey, we're changing the Medicare card around. We're going from paper to plastic. That's not the case. Social Security still administers sending you all that card. That card will be paper. You know, Medicare pays the private sector. These insurance companies that we all are aware of, Blue Cross, United Healthcare, all these companies, Medicare pays them to provide you with a service. Well, they're in the business, folks, because they want to make money. They want to profit. So sometimes they'll push the envelope a little bit as well so that they can make or turn a profit, right? And sometimes they will use the fact that we don't know all of the rules as an excuse. Okay, so we have to be careful with that. Home health care fraud, hospice, pharmacy, prescription drugs. You have to be careful with things of that nature. Okay, so those are things that we want to look at. Marketing rules, there's some things that they can't do any longer that they used to. They now have to basically, private sector companies, when they market to you, they have to make sure that they don't use the Medicare logo, CMS. They can't look like they're coming from Medicare themselves. They have to do a disclaimer now. When they have a commercial, these private sector people, they have to tell you in order to get a free, unbiased look at all of your Medicare options, you need to look at your SHIP office, which is us. right? So we've been kind of beating the bushes about that over the years, because what the private sector would do is have people believe that this was the only place I can go and get the help. Prescription drug fraud. Report potential prescription drug fraud if you see claims on your Medicare statement. This does happen a lot, folks. Again, not just doctor's appointments and things of that nature. Sometimes medications, they will literally, put on your account that they gave you this as prescription or that prescription, particularly if it's done at a doctor's office. So just kind of look at those as well as you look at your summary notice. Just mentioned this earlier, paper or plastic, they're always going to be paper cards. They will not be plastic cards. So basically, how do we prevent this thing from happening? We basically don't give our Medicare number to anybody, right? And we don't give your Medicare number for free services, the free back brace, free knee brace, all that kind of stuff that comes on television. That stuff shouldn't happen, right? You shouldn't be giving your number for that. Basically, treat your Medicare card as a credit card. Detect. Well, I just kind of mentioned, look at your summary notice. This is a way you detect fraud, is actually look at your explanation of benefits. If something looks fishy, if it doesn't look right, we always say, first call your doctor's office. See if that works. See, sometimes it's a legitimate error, right? After that, then contact us. If it looks like it's something that they didn't do or you're not getting any help there, we want to make sure that we are able to actually get these things reported. So shred any of your medical personal information, or at least rip it up if you don't have a shred. Report. Again, we're asking you to contact us. If you do get that suspicious phone call, you answered the phone, they start talking Medicare stuff, it's okay to hang it up on them. That's fine. We don't mind. Call and give us the number, though, that called you. Let us report that. That's one of our biggest pet peeves, is we don't have enough people that call us and actually report just that simple phone call. Well, you don't have to be the expert. It doesn't have to be a bunch of detail. Hey, look, I got a suspicious call. They called from this number, James. I'm going to send it to the feds. We ask people to just kind of help us get the word out. That's all. Because many people in this room may or may not have ever even heard of Senior Medicare Patrol.